United Health Group is bringing in-home treatment directly to patients, closing care gaps, identifying risks earlier, and improving patient outcomes. In 2025, patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
The new LinkedIn Hiring Pro can't undo your last hire. The empty seat. Who was actually just that? An empty chair in your office because you couldn't find someone to fill it. So it just sat there costing you money with all its fancy ergonomic features. But LinkedIn Hiring Pro can make it easy to fill that seat with the right candidate. With nearly 60% of businesses finding someone to interview in the first week alone. Hire right the first time with LinkedIn Hiring Pro. Post a free job today at linkedin.com/Pandora.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
You know what I could really go for right now? Literally anything that comes in a McDonald's carton, wrapper, or bag. Or a McDonald's cup. Yes, any of those items should do it.
We've got your cravings covered. Now stop in for the flaky Filet-O-Fish, the crispy snack wrap, or large fries for just $2.99. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.
Dr. Sylvia Owusu-Ansah was on the ride of her life in 2025. The pediatric emergency physician received an honorary Emmy Award for her work on the hit medical show The Pit, and her own film was selected as a finalist for the HBO Short Film Showcase. She was celebrating with a friend at the American Black Film Festival when they heard a mutual acquaintance had passed away from colon cancer at age 45.
And my friend looked sternly at me and she said, when you go home, you better not mess around and you better get all your screenings done. And I hate to admit, I hadn't had a mammogram in 4 years. I was overdue for my colonoscopy by 2 years. And at the time I was having left upper quadrant pain as well for 6 months that I didn't know what was going on. And so was simultaneously scheduling for workup with that.
Staying true to her word, Owusu-Ansah flew back home to Pittsburgh and began checking appointments off her to-do list. The endoscopy for her GI tract came back clear, and a colonoscopy showed there wasn't even a polyp to worry about. The mammogram was her last obligation. She noticed some abnormalities during the scan, but wasn't too worried.
Like most women, I was considered to have small, dense breasts, which usually you spot like a lot of benign tumors. I had a biopsy done over a decade ago. And so I had many mammograms where I flagged for these benign tumors and, would get the mammogram and then I'd have to wait to talk to the radiologist. It was like the same old, right? It was never just a mammogram and go.
But this time, the test showed some additional irregularities in her lymph nodes. Still not thinking it's a big deal, Owusu-Ansah scheduled a repeat test. A month later, she sat for the same scan, but noticed the physicians were more active than usual.
Getting a mammogram and they were doing, again, I'm a physician, doing way more shots than they usually do. I usually don't get an ultrasound with my mammogram. So they suggested I get an ultrasound. And then again, I'm a physician. There was a circle in my breast and the ultrasonographer is measuring that circle. And so then I knew something was wrong. The ultrasound tech can't say anything. And she's got the measuring calipers up, she's measuring the tumor, so to speak. And I'm like, well, it could just be a big benign tumor. But so I laid there quietly and I was kind of in shock, because I knew what I knew, but I tried to unknow what I knew.
It would take another month and a biopsy to confirm one of Owusu-Ansah's greatest fears had come to life.
I get the call, the call that you see on these Hollywood movies of like, is this Sylvia Owusu-Ansah? I said, yes, it's Sylvia Owusu-Ansah. This is Nurse X from X, Y clinic calling about your biopsy results. And I could tell from the tone that it's cancer. It wasn't good. And so she said, yes, very monotone, very robotic. Yeah. So your, biopsy results came back and you have invasive ductal carcinoma, which is a type of breast cancer. And I'm a doctor, so I understood that much. And then the rest was almost like Charlie Brown's mom talking, you know, wah, 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 wah.
Invasive ductal carcinoma is the most common form of breast cancer. It starts in the milk ducts, then spreads to surrounding tissue. Owusu-Ansah knew this much, but that's as far as her expertise could take her.
Now with cancer, they do all kinds of markers. They look at all kinds of proteins, basically, that help to delineate what type of cancer you have, how fast it proliferates, how aggressive a tumor is, whether there's a risk of recurrence. I didn't know any of this. I have not looked at breast cancer since medical school. So that was over 20 years ago on slides. And obviously things have changed since then. So this was complete Greek to me. And I think that's when I really was like, I got to advocate for everybody else in this boat, because I'm like, if I'm a physician and what you're telling me is Greek, I can't imagine the woman or even the rarer man off the street who has breast cancer and comes in and you're telling them all these things.
Owusu-Ansah says the decision to publicly share her journey on social media was a no-brainer. With so many unknowns in her future, she jumped at the chance to have any sort of good come out of this diagnosis.
I don't know whether I'm going to live or die from this. I don't know whether it's going to be stage 4 or just 2B, but I've got to do something with this diagnosis outside of fighting for my life. So I decided right then and there that no. With this experience that I'm having right now, my initial mammogram in July, having to wait another 30 days to get some kind of confirmation and then another 2 weeks to get a biopsy. And I'm a physician in the system. We got to do something different.
Owusu-Ansah announced her diagnosis to the world on October 1st, 2025, and has continued to keep her followers updated on her journey, never shying away from the hard parts. She's been able to show how a doctor advocates for care as a patient, especially realizing that many people often feel powerless in these settings.
They don't feel that they have that autonomy or flexibility in any kind of way. I do have some of that. The best example I gave was I was starting to have, so my first chemo, I didn't have my port inserted yet in order to easily get blood work done and for the chemo to infuse without them having to poke me several times. And so one of the nurses, the only vein she could find was in my right hand. And so the first chemo was infused in my right hand. And I tried to explain to her, this is probably not a good idea.
Despite Owusu-Ansah voicing her concerns, the nurse moved ahead with using her right hand as the entry point. It would be another month before she'd get her port put in, and Owusu-Ansah wasn't willing to delay her chemo any longer.
So she fused it in my hand. It's interesting. She's the same nurse that followed up 2 days to see how I was doing. Was like, I didn't realize you were a doctor. I'm so sorry. And in my head, I said, it doesn't matter. It doesn't matter that I'm a doctor. I'm a patient, should advocate. So anyway, soon after that, I started having numbness and tingling in my right hand, predominantly in my DIP joints, at the tip of my fingers, predominantly my middle finger. And then the next chemo cycle came and there was more neuropathy in my right hand.
Her care team didn't think it was related to the chemo, but as the symptoms worsened, Owusu-Ansah wasn't willing to accept that answer.
And so I believe by cycle 3, really was very vocal. I was vocal through all of the chemotherapy cycles, but I was really vocal after cycle 3 that, hey, like, I can't even wipe myself, excuse the detail, but and this is my right hand and I'm an ER doc and I'm getting concerned and, I don't want it to be an irreversible process, at the end of the day. Right. And my nurse did say, advocate for yourself early. If you let us know about these things later on, then these things can be irreversible. So long story short, my medical team for my 4th cycle of chemo reduced the amount of chemotherapy. And guess what? After that chemotherapy, my hand was as good as new.
Still, Owusu-Ansah says her team wasn't dismissive of her, and they were looking into other possible causes, but changing her entry point did bring back function in that right hand. It's that open communication that Owusu-Ansah says is so important to have between patients and their care team. Asking questions is one of the best things a patient can do.
Ask all the questions. Ask about the chemo. Why this type of chemo, not another type of chemo? Why are we doing chemo first and not surgery first? What is the purpose of radiation? What are the additional side? What should I be expecting over the next 6 to 8 weeks, right? Knowledge is truly power. Even if you think it's the dumbest question in the world, ask it of your medical team. And if they can't answer, push them to find somebody to get the answer for you or circle back with the answer.
And since these situations can be overwhelming and intimidating, she says that it's always a good idea to bring a loved one along who can help advocate.
It's not easy for everybody to advocate for themselves. And I recognize that. It's not easy for everybody to speak up. And it can be very intimidating, especially if you go by yourself. So I always advocate, bring a partner with you if you can, especially for those who don't like to talk or not very verbose or very quiet, to have somebody speak up on your behalf, whether it be your spouse, your partner, if it's your parent, you go in for your parent, your parent bring their child in. If it's an older parent, bring your adult child in, vice versa.
In addition to speaking up in appointments, being the best self-advocate also means being knowledgeable about what you're up against. Owusu-Ansah advises reading up on your disease and the range of treatment options available. You can find more information about Dr. Sylvia Owusu-Ansah and her social media journey on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
The new LinkedIn Hiring Pro can't undo your last hire. The empty seat. Who was actually just that, an empty chair in your office because you couldn't find someone to fill it. So it just sat there costing you money with all its fancy ergonomic features. But LinkedIn Hiring Pro can make it easy to fill that seat with the right candidate, with nearly 60% of businesses finding someone to interview in the first week alone. Hire right the first time with LinkedIn Hiring Pro. Post a free job today at linkedin.com/Pandora.
Fidelity Active ETFs have the flexibility to shift and transform as markets do the same. So instead of just riding an index, they can seek to outperform it by adapting to market conditions and pursuing new opportunities as they emerge. And while you get the potential outperformance of an actively managed fund, you can still buy and sell it on your terms, just like any other ETF. Markets can change in real time. Make sure your ETF can too. Learn more at fidelity.com/active ETFs. Before investing in any exchange-traded fund, you should consider its investment objectives, risks, charges, and expenses. Contact Fidelity for a prospectus, an offering circular, or if available, a summary prospectus containing this information. Read it carefully. While active ETFs offer the potential to outperform an index, these products may more significantly trail an index as compared with passive ETFs. ETFs are subject to market fluctuation and the risks of their underlying investments. ETFs are subject to management fees and other expenses. Fidelity Brokerage Services, LLC, member NYSE, SIPC.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
You know what I could really go for right now? Literally anything that comes in a McDonald's carton, wrapper, or bag. Or a McDonald's cup. Yes, any of those items should do it.
We've got your cravings covered. Now stop in for the flaky Filet-O-Fish, the crispy snack wrap, or large fries for just $2.99. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.